And take a look at this. Protesters outside Kootenai Health pleading with the hospital to reevaluate a cut to services. They think Kootenai Health is making a major mistake that could cost people their lives. The hospital is closing the Addiction Recovery Center and an outpatient psychiatry practice.
Well, they blame statewide underfunding and a lack of staff. People are worried this will have a detrimental effect on the overall well-being of people in North Idaho. Tonight at 6, Esther Bauer explains why they're fighting back.
People say addictions and mental health are a growing crisis the hospital cannot avoid. They're organizing this rally to let Kootenai know they don't stand behind this decision and it will hurt the most vulnerable.
This is just such a devastating blow for our community.
A community in need of care that's getting cut.
We know that our region is growing, so a reduction in access to services can't be happening.
Following COVID, new data shows 35 million people could be diagnosed with a behavioral health condition.
As we're increasing diagnosis, we can't decrease access to services.
We're in the heart of a opioid epidemic, unfortunately, and death rates because of substance abuse are higher than they've ever been. So we need to have this resource for this community.
Hannah Nixon is a local psychologist. She isn't sure where she's going to send patients in crisis.
I fear that our local emergency rooms are going to be even more slammed than they already are. I think our primary care physicians are going to get slammed, and who knows what other systems in this community are going to feel the weight of this decision.
It's a decision the hospital says it had to make. In a statement, they say behavioral health programs have been chronically underfunded nationally and statewide for decades. The COVID-19 pandemic, staffing shortages, and subsequent financial hardships have made it more challenging than ever to provide these services. Services Jessica Bonar doesn't take for granted.
When it came to alcoholism, I could not stop on my own. I tried and I couldn't, and I needed the help of other people.
People who could be at risk of never getting the care they need.
I can't imagine where they will go. They won't be able to stay in their own community and get the help they need.
And the hospital also says while they may agree with this protest, people need to take rallies like this to Boise and Washington, D.C. They say change will only come with legislative and voter support. Reporting outside Kootenai Health tonight, Esther Bauer, 4 News Now.